How is induration interpreted for a TB skin test? Imagine getting a small shot on your arm and then waiting a couple of days to see if your body reacts. That's exactly what happens with the tuberculin skin test, also called the Mantoux test. After the test is done, a healthcare professional looks for a specific kind of reaction called induration. Induration is a hard, raised, palpable bump that forms under the skin where the tuberculin was injected. It's important to note that redness or swelling alone doesn't count. Only the hardened, raised area is measured. The measurement is taken in millimeters across the skin, perpendicular to the long axis of the arm. Only the size of the induration matters, not the redness or general swelling. If there's no induration at all, the result is recorded as 0 millimeters. The size of this induration helps determine whether the test is positive or negative, but it depends on the person's risk factors for tuberculosis. For people at the highest risk of developing tuberculosis if infected, a small induration can be significant. If the induration is 5 millimeters or more, it's considered a positive result. This includes individuals living with HIV, recent close contacts of someone with active TB, those with certain chest X-ray changes suggestive of old tuberculosis, and people with weakened immune systems, like organ transplant recipients or those on high doses of corticosteroids. In people with an increased but not the highest risk, an induration of 10 millimeters or more is considered positive. This group includes recent immigrants from countries with high tuberculosis rates, injection drug users, residents or workers in high-risk settings such as prisons or homeless shelters, laboratory workers, and people with specific medical conditions that raise their risk. For individuals with no known risk factors, an induration of 15 millimeters or more is needed to be considered a positive result. These cutoffs are based on guidelines from health authorities and aim to balance detecting true infections while reducing false positives. It's crucial to understand that a positive skin test doesn't mean you have active tuberculosis disease. It only indicates that you have been infected with the bacteria at some point. To find out if the infection is active or latent, doctors will do further tests like a chest X-ray and review your medical history. The test must be read by a trained healthcare professional between 48 and 72 hours after the injection. If it's read outside this window, the results might not be accurate and could requiring repeating the test. When recording the results, always note the exact millimeter measurement of the induration, not just whether it's positive or negative. In summary, interpreting a tuberculosis skin test involves measuring the size of the induration and comparing it to risk-based cutoff points. This helps healthcare providers decide if further testing or treatment is needed. Remember, always consult a healthcare professional for personalized advice and follow-up, as individual risk factors and health conditions can influence the interpretation.